Hello there. My name is Oriyomi Dawodu. I will be talking about my experience this summer with the Global Health Institute Scholars. And the name of my project title was Facilitators and Barriers for Neurodevelopment Follow-up in Limerick, Ireland, Evidence from a Qualitative Study. So I'm going to take this time to briefly talk about myself, go over the site, the research overview and design, and just some key takeaways from this experience. So a little bit about me. I am a public health professional with over a decade of combined experience in health communications, global health research, and program management. I've spent these last 10 years of my life supporting maternal and child health programs, both in the US and overseas. Currently, I am in my fourth year, my Doctor of Public Health program in maternal and child health. I'm also doing a minor in epidemiology here at the College of Public Health. And then prior to that, I earned a postgraduate certificate in global health and some other professional certificates from Columbia and Hopkins. And then prior to that, I completed a master's in health promotion education and also received a bachelor's of arts in communications. So a little bit about the project site. So again, I was at the University of Limerick, Ireland, and my PIs were Dr. Noor Ibrahim, who's faculty in the School of Medicine, and Dr. Mujahid Ibrahim, who was a neonatologist at the University Maternity Hospital, Limerick. So UMHL is among Ireland's 19 maternity units and has the country's fifth largest distribution of births. UMHL is the only maternity facility in Limerick, and it serves over 465,000 people. And that includes residents living specifically in Limerick, Clare, North Tipperary, and adjacent catchment areas. So as you can see here, this is actually the campus, though. Specifically, this is one of the residential quarters. This is Tallman Village specifically. This is where I stayed, and such a beautiful campus, a lot of green. So that was something that I really enjoyed seeing as I was going in and out of the campus of the hospital and to the College of Medicine. So this project entailed about three components. First, I did an observership at the hospital, and this was organized by Dr. Mujahid. And what I did is that I shadowed several members of the NICU team. So that included a physiotherapist, a discharge nurse, and also an advanced nurse practitioner. And during this time, I saw therapies, including chest and neuromuscular physiotherapy for babies in the NICU and newborns within the midwifery ward. I saw different discharge procedures, learned about those discharge procedures, and also some of the parent education programs and services that were offered. And then another thing that I noticed, that I observed rather, were clinical interventions and procedures, which is a bit different from my own side because it's more clinical than the public health interventions. But just looking at PICCU as well as intubation, which was definitely different from what I've done previously. So it was very interesting, but also slightly scary because you do see babies in distress. So it was a very interesting experience being in that clinical space and learning and seeing how the NICU team works and how they were just so dedicated to take care of these babies and also the parents as well. So part two of this was a public health workshop experience. And as you can see here, these are some of the MPH students that are currently enrolled. These students are actually in their second year. When I was there, actually, they were getting ready to defend their final project. So it was really nice seeing all the students come together and work together and have all these different workshop activities. And we did things on scoping reviews. We learned more methods in qualitative research and quantitative research. So it was a great refresher, and also just learning from these colleagues also in public health. And many of them had ranges of experiences. Some were medical doctors. There was actually one student that was a medical doctor from Korea. And then there was also a pharmacy student. And then there was, a pharmacist rather, and other different people in different fields and sectors. And most of them were international students. Some were also Irish natives, and some of the students included students from Nigeria, Russia, Cameroon, Somalia, Sudan, and Kenya. And also there was an American student as well. And the third component was the research. Obviously, that is the most critical piece of this experience. And while I was there, I worked on ethical approval for the project, and that will be similar to what we would call here the IRB. So developing a protocol, flyers, informed consent forms, an interview guide, doing a literature review. So I spent a lot of my time gathering this information and learning about Ireland and learning about the infant morbidity problems that they are currently dealing with, especially with their backlog and waitlist services. That is another big issue that I'll talk about shortly. And then this research specifically is a qualitative study. So we were trying to conduct interviews with members of the CDNT teams, or the Children Disability Network team, to examine facilitators and barriers to neurodevelopment follow-up in Limerick County. So I'm going to talk about the research overview and then what the design was. So just a quick background about Ireland, or neonatal issues in general. It's about estimated that 15 million infants worldwide are born prematurely, and nearly 6% of babies born before 37 weeks of pregnancy will die from these complications associated with preterm delivery, while survivors are likely to suffer from intellectual and developmental challenges. But it's recommended that a comprehensive follow-up of these babies, particularly infants that are born before 28 weeks of pregnancy, it is essential to early identification and prevention of disability later in life. Unfortunately, Ireland is not doing too well. It's among the few high-income countries in Europe performing poorly in infant and maternal mortality. Many of the issues regarding infant and maternal mortality can be associated or related to the national shortage. It's a big problem in Ireland. Also, the clinical staff shortage, the backlog and waiting lists for healthcare services is often cited as a major contributor to the availability of services and treatment. However, this research project was developed because little is known about the pathways for successful neurodevelopment follow-up of preterm babies in Ireland. So our research objectives had two main objectives. The first one was to examine the understand the experiences of the clinicians and allied health professionals in implementing and coordinating neurodevelopment follow-up in Limerick County. And then two, we want to identify an ideal ratio of healthcare professionals for at-risk infants enrolled in neurodevelopment programs currently in Limerick. So these were the two main objectives. Currently, we're still working on this research. I just finished my last interview maybe 3 weeks ago, and I've conducted 7 interviews so far, and they included different allied professionals from all throughout Limerick, from the 6 different CDNT teams in the region. And my interviews included a physiotherapist, psychologist, as well as a nurse, several different people. So it's a really great range and really good conversations that I had, and learning more about these different experiences. So we're hoping to work on the analysis and continue to find themes through the thematic analysis. So this is really, really great, especially this is something new that I've done that I have not done previously with regards to qualitative research. So it was definitely a big learning experience for sure. So just some key takeaways. One, have humility. This is something that Roxana and Dr. Valdez from GHSI have told us, that entering in this experience, we need to be humble. Different culture, sometimes a different language. You just have to be open and recognize that things will be different from what you're used to in the States, or from wherever you're from. Things will be used to when you're in a different environment. So quickly I learned, I've always had this in mind, but it was definitely very, very clear to me that things were different, and I had to make sure that I embraced the newness and also be humble in this space. And then be patient. Research changes, objectives changes. It's really hard sometimes to implement research, especially in a different space that's outside the US. The ethical approval is different. And then also getting participants, enrolling participants, getting the sample that you need requires a lot of patience. So definitely, if you are someone considering this program in the future, remember that research, especially overseas, might not go as planned as you expected it to be. And then network. This is an opportunity to get to know more colleagues in public health in a global space, get to know more about them and their research and what they're doing, and hopefully could be somebody or some group of people that you can collaborate in the future and help you on your road in public health in this journey that you're on. And then finally, have fun. This is a learning experience, but it's also a fun experience too. Go out, do different things, talk to the different people in the community outside of the work experience that you're currently doing, the research experience. Learn more about the culture, the food, try different things. So I would definitely say it's good to work hard and also play as well. And these are some of my fun photos of me playing. This is me specifically in Dublin, and I went with one of my housemates that I was staying with to the National Gallery of Ireland, and we did some other fun things in Dublin. It was such a beautiful time. So these are my housemates here. 3 of them, one was from Algeria, and 2 were from India, and they were so sweet. This is a goodbye cake they gave me. So thank you so much for listening, and yeah. Thank you.